Welcome to my channel, The Fit Hub. I am telling about COPD symptoms and prevention. COPD symptoms. COPD symptoms tend to develop slowly over time and worsen as the disease progresses. The symptoms can vary in intensity and might not be noticeable until the disease has advanced. Common symptoms include shortness of breath, dyspnea. This is the hallmark symptom of COPD, especially during physical activities. Over time, it may occur even at rest as the disease advances. Chronic cough. A persistent cough often described as a smoker's cough that lasts for months and can be worse in the mornings. Excessive mucus production, sputum. People with COPD often produce a lot of mucus, which can make coughing worse. The mucus can sometimes be clear, yellow, or green if an infection is present. Wheezing, a whistling or squeaky sound when breathing, particularly when exhaling, caused by narrowed airways. Fatigue, feeling tired or worn out easily, even without exertion, due to the body working harder to get enough oxygen. Frequent respiratory infections. People with COPD are more prone to respiratory infections like colds, the flu, or pneumonia, which can exacerbate symptoms. Chest tightness, a feeling of pressure or tightness in the chest, often associated with difficulty breathing. Unexplained weight loss. In more advanced stages, people may lose weight due to the body's increased energy use to breathe and fight infections. Swelling in ankles, feet, or legs. This may happen when the heart becomes strained by the lungs' inability to provide enough oxygen, causing fluid to build up in the body. Cyanosis, bluish discoloration of the lips or fingertips indicating low oxygen levels in the blood. COPD prevention. Although COPD is often caused by long-term exposure to harmful particles, particularly from smoking, there are several measures that can help prevent or delay the onset of the disease. Quit smoking. Most important preventive measure. Smoking is the leading cause of COPD, and quitting at any stage can slow the disease's progression or prevent it altogether. Support groups, medications like nicotine patches or prescription drugs, and counseling can aid in smoking cessation. Avoid secondhand smoke. Even if you're not a smoker, exposure to secondhand smoke from others smoking around you can significantly increase the risk of developing COPD. Minimize exposure to lung irritants, environmental pollutants, such as car exhaust, dust, fumes, and chemicals. If you work in a hazardous environment, be sure to wear protective gear such as masks or respirators. Indoor air pollution. For those living in areas where burning wood or coal is common, avoid prolonged exposure to indoor smoke. Using air purifiers can help reduce indoor pollution. Get vaccinated. Vaccines for the flu, pneumonia, and COVID-19 can help reduce the risk of respiratory infections that can trigger COPD exacerbations. Practice good hygiene. Frequent hand washing, avoiding contact with sick individuals, and regular cleaning of surfaces can reduce the risk of respiratory infections, which can aggravate COPD symptoms. Regular exercise. Maintaining lung health by staying active and doing aerobic exercises can improve lung function and overall endurance. Even light activity such as walking can help improve oxygen use. Stay healthy with a balanced diet. Eating a nutrient-rich diet, rich in fruits and vegetables, helps maintain overall health and supports lung function. Avoid excessive salt, which can contribute to fluid retention and exacerbate breathing issues. Maintaining a healthy weight is also important, as being overweight can strain the lungs and heart, while being underweight can make it harder to maintain the strength to fight off infections. Monitor your health. If you're at higher risk, for example, if you've been smoking for years or have a family history of lung disease, see your healthcare provider regularly. They may suggest lung function tests to detect early signs of COPD. Control air quality. On days when air quality is poor, due to pollution, pollen, or weather conditions, limit outdoor activity. Using a humidifier indoors can help keep airways moist, but ensure the air is clean and fresh. Breathing exercises. Techniques like pursed lip breathing and diaphragmatic breathing help improve lung efficiency and are often used as part of pulmonary rehabilitation to increase lung capacity. Avoid occupational exposure. Certain jobs, e.g., mining, construction, or manufacturing, expose workers to harmful dust and chemicals. If you work in such an environment, wear protective gear and ensure proper ventilation. By implementing these preventive measures, it's possible to delay the onset of COPD.